Hi friends, exercise is a very important tool for everybody. Exercising in pregnancy is also important. Way back in 1997, I wrote an article in Deccan Chronicle, Benefits of Exercise in Pregnancy. Till now, we are not fully geared up to prescribe proper exercise program for pregnant women both before and after the pregnancy. Let me tell you, there are a lot of benefits of exercise during pregnancy. But before one becomes pregnant, even before conception, they should be reasonably fit. I mean, they should do regularly household activities and some amount of aerobic exercise like running, jogging, walking, and also do some strengthening exercises, some modified yoga exercises. All these have greater benefit. While you walk, jog, do activities, you should be able to breathe enough oxygen and your heart should be able to pump all over the body sufficiently. That is the benefit of aerobic exercise. During pregnancy, the uterus goes up into the abdominal wall, it presses the lungs, so that's why pregnant women breathe with greater difficulty. First exercise is aerobic exercise. The ladies who become pregnant, they should not stop doing all activities and other exercises unless your doctor says, please have bed rest. When there is high blood pressure, there is some less fluid in the uterus or sometime other complications where doctor can tell you, please do not exercise and take bed rest. You must adhere to your doctor's advice. Ideally, you must walk at least 20 to 30 minutes every day so that you maintain slowly your aerobic benefit throughout the pregnancy, even after delivery. Fit women can have largely normal deliveries and do not have many complications. What is the second exercise program which benefit women? Pelvic floor exercises. Coccygeus, pubococcygeus, and there are so many perineal muscles. All this pelvic floor we call it. This becomes weak during delivery, even during surgical procedures performed during deliveries. You must have a very strong pelvic floor. How do you know that you have a strong pelvic floor? If you are passing urine, if you are able to stop the urine flow several times, that means your pelvic floor muscles are in a good shape. Lot of scientists since long time they have evolved Kegel exercises and pelvic floor exercises. So pelvic floor exercises you should start before conception. Nowadays lot of women complain, I am carrying weight and my urine is dripping. I am climbing steps, my urine is coming out. They have no control. We also call it incontinence. So after delivery, incontinence can be a major problem in many women whose pelvic floor is weak. So that's why during pregnancy, you must do pelvic floor exercises regularly. Third important part, your abdominal muscles should be strong. I mean, during pregnancy, if you do very rigorous exercise, like jumping and dancing and climbing and skipping, sometimes if you are already having a poor abdominal wall, that your rectus abdominis muscle will open up. We call it diastasis recti, and this is one of the common causes for many women developing hernias after delivery. A lot of women suffer from umbilical hernia, lower abdominal hernia because of the weak abdominal muscles. So if you do rigorous exercises, if you are not prepared, you are not trained. Imagine, I heard the other day some video dancing during pregnancy. My God, if you are not danced in your lifetime, if you think dance is going to help you, it is a catastrophe. People with inadequate knowledge of exercise in pregnancy prescribe those things. And be careful not to do too much of squatting unless your adductor, that is inner thigh muscles, and pelvic floor, it should be strong enough. A weak lady with all these weak muscles, if you do suddenly lot of squats, half squats, quarter squats, then you are likely to injure yourself. So ladies who want to dance during pregnancy, yes, you can have a casual dance, but you cannot really do a serious, active, powerful dance during pregnancy unless you have been doing before conception. Is it clear? And next important thing is your diaphragmatic breathing exercises. In a normal delivery, your doctor says, please put pressure so that baby comes out. You need a very good diaphragm. Diaphragm develops because of the training. There are a lot of yoga breathing exercises, Kapalabhati, Basrika. There are many specialized purse string breathing. These you have to practice before conception. I am repeatedly telling, not during pregnancy, before conception. Before you become pregnant, all this you have to do. Yes, it's never late. Even after you become pregnant, you may do this, but you must be at guard. If you do forcibly, your membranes may break. You may have a premature delivery. Exercise has definitely good benefits, provided you do under good supervision, and you should not have any risk factors like hypertension, extreme diabetes, already weak abdominal muscles, already undergone 2-3 C-sections. You have a urinary incontinence persisting, or you are having a delivery after 34 years. Today it's become fashion, no? Getting pregnant at 35, 36. Some celebrities have put a new benchmark for younger ladies. So be careful. Finally, I'll summarize what you should do. Before conception itself, so you must be doing aerobic activity 30 to 45 minutes, walk, jog, run. If you're doing aerobic exercises like aerobic dancing or Zumba, no problem. If you've been doing till conception, you may do. Then number 2, do every day some breathing exercises. Take a deep breath. Leave your breath with abdominal wall. Strengthens your diaphragm. Using the lower abdomen, you leave your breath, because once you become pregnant, lower abdomen is occupied by baby and you will have to use only thoracic breathing. So till then, you do this breathing. Hold your umbilicus and do breathing with the thoracic breathing. You're doing only with the chest. Like this, you do a good breathing exercise program before conception. You do it throughout your pregnancy. It will help you in delivery. Thirdly, if you want to do squats, you may do some wall supported squats. We used to call Goda Kurchi. Take a support of the wall and do it nicely. I must tell you, there is one Yogasana, Baddha Konasana, the fantastic exercise for pregnant women. You sit against the wall and in a butterfly position, you open your thighs, fold your legs. I am putting one picture for you. Baddha Konasana, you sit couple of minutes every day in Baddha Konasana. It will stretch all your pelvic floor muscles and strengthen. That will really help in delivery. Last but most important, during pre-delivery, the last trimester, last 3 months, there is one hormone, relaxin, is released in the body. Your flexibility increases. That's how the baby comes out of the narrow bony pelvis very freely. Beyond 5 months onwards, you should be careful to do any rigorous exercise, because you are more flexible than before and you are likely to get injured. So dear ladies, exercise in pregnancy has definite benefits. And lastly, taking care not to have falls, not to slip down. This can prepare you very well for your delivery. If you're a strong woman, you may take a normal vaginal delivery rather than C-section. Of course, there are some indications of complications where we need to do C-section. Myself and my team, we started giving this prenatal, postnatal, during pregnancy exercise program long ago, almost 1996, 97. I remember Dr. Savita Devi and her team promoted to prescribe these exercise programs. So if you're doing any exercise, please try to understand this. Start exercise program before conceiving itself. All the best.